Typhoid fever. Introduction. Typhoid fever is most common in developing countries. Select true or false. Correct. Living or traveling in Asia, Africa, or Latin America may increase your risk of catching typhoid fever. Jason has a fever that has gotten worse. He also noticed a rash on his chest and has been having headaches. Should Jason contact a healthcare provider? Select yes or no. Correct. A high fever and a rash could be signs of a problem. Jason should contact his healthcare provider. The bacteria that cause typhoid fever can spread through contaminated food or water. Select true or false. Correct. If a person who is infected doesn't wash their hands after using the toilet, they can spread the bacteria that cause typhoid fever. Sam was diagnosed with typhoid fever and he has been taking antibiotics. After a few days, he started feeling better and his fever went away. Should Sam choose one of the following options? 1. Stop taking his antibiotics. 2. Continue to take all of the pills he was prescribed. Correct. Symptoms can return up to 2 weeks after the fever goes away. Sam should take his antibiotics for as long as his healthcare provider recommended. Which of the following can help prevent typhoid fever? Choose one of the following options. 1. Buying bottled water to drink. 2. Boiling your water for 1 minute before you drink it. 3. Peeling fruits and vegetables. 4. All of the above. Correct. Thank you for using Explain.